roll call already, but is anyone on the line that I missed that logged in after? So far I have myself, Palace, Kathy, Andrea, Leslie, Robert, Pete, Michelle, and Kathy. Okay. I can also pull up the minutes from our last meeting if you would like me to, Kathy.
That sounds good. You could go ahead and do that. I have my hard copy from the November 27 meeting.
Yep.
So if people want to, if you have that available, you can take a look at it. And if not, that'd be great, Gloria, if you could pull it up for those who can read them online.
Yeah, they're up there right now. Looks like Mary just joined us, so I'm going to mark her as well on our agenda.
Okay, great. Thank you.
Mm-hmm.
So if people want to take a minute to review the minutes and see if there's anything else in there that we need to add or revise, and then we can approve.
Hi, Kathy. This is Andrea. I had read the minutes, and I didn't see any changes that need to be made at this point.
Okay, thank you. Anyone else have any comments? Okay.
Okay.
So can we accept as is then, unless we hear differently? Okay. The other thing that we had talked about and is on the agenda is the survey results, and some of them were updated a little bit. And I don't know if people had a chance to go through and look at those survey results again. The first, do we want to go through them by question? The first one was, in your opinion, what should the Allied Health be working on this year? And I know we talked about these last time as well. Any further discussion?
Hi, Kathy. This is Andrea again. I sent out to all my Allied Health colleagues the revised survey, and it looks like we had quite a few responses since our initial October release of the survey. And I think we got some really good, kind of more focused answers, and I definitely can relate to a lot of these answers. So I'm not sure if we should comb through them or talk about them, you know, each one, or however you guys would like to approach it. But I think we got some good feedback this time, which I'm really excited about.
Yes, I can see some of that as well. And I think it's like even on this first one, when it talks about, it is focused, reducing administrative burden on the faculty. That's an interesting one. Focus on the Board of Regents mandate to double the number of graduates by 2025. Focusing on the high school. Oh, we talked about that one last time, though.
The second one as well, where better communication with advisors at campuses throughout the state that's an important one as well. I agree. I was really impressed with the better answers to the second survey.
Any other comments on that first question, or where we want to go with this, how we want to focus in, or do we want to pick a couple that we really think and then talk about it, or do we want to have a smaller group get together? Not that this isn't a small group, but get together and over the next time, between now and the next time we meet, come up with some recommendations specific to what we can target I think we picked a couple of them from each of the 3 questions.
Hi everyone, this is Andrea again. Sure, yeah, we could do it that way. I feel like there's a lot of overlap with the responses. It seems like prioritizing collaboration and communication with the allied health programs across the campuses seems like a pretty high priority. And then in terms of reducing the administrative burden on faculty, that's a really good answer, and that's a big one to approach. I'm not even sure how to approach that one, but it looks like there are, like I say, some overlap. So it looks like the people who are responding kind of share the same concerns that we've all had in discussions with the AHA group as well. So, you know, that could be something we could reserve for a smaller group or discuss it now, either way.
Kathy, this is Michelle. I was wondering if it would be helpful to group the questions where they do have overlap, you know, into subsets, and then really define what each of them mean. For example, the faculty and the administrative roles, I think given that we have 3 different large universities in Alaska, administrative roles at one unit may be different at another unit, and so have those clear definitions so that we can then identify solutions.
Okay.
And this is Gloria. We do have the time, so if you guys want to try to do that, I could take the notes now. That way we kind of have those identified.
Identify the grouping specific.
Yeah, the different groupings. So far I heard communication across campuses and across universities and campuses across the state, faculty and administrative roles. I think there was something about advising, or would that fall under communication still, perhaps? Yeah, it's communication with advisors. So I guess it falls in that same category. There's this focus on, you know, I see something in here about how to expand across this, how to expand to meet these Board of Regent mandates.
Right.
I'll put something to that.
Increasing numbers.
I do see this advising kind of come up again. I don't know if we want to have a couple things on advising.
I was wondering,
specific.
I was wondering that too, Gloria, because the communication piece, I think, is throughout it. Mm-hmm. And if we go back to the purpose and history of AHA, it is to work collaboratively, and that is the purpose, is that increased communication through AHA. So, but I think that's one thing that we can talk about, because we haven't been meeting and somehow our numbers at the meetings are not as what they used to be, and maybe that a face-to-face meeting would help that some. But also the advising communication piece, I think, should be separated out, because I think it's 2 separate issues.
Okay. And let me know if you guys want me to scroll. I don't know if everyone's looking at my shared screen or if they have their version open in front of them, but I can scroll through the next question if you'd like.
Sure, that sounds good.
Okay. This is number 2. And this was more directly on how can we collaborate better? How can we improve collaboration? And just before I get there, while you guys are looking at that, I did see another caller call in. Can whoever just called in kind of a little bit ago, if you can identify who you are so I can mark you as present.
Yeah, this is Wanda Wall-Fulton calling in from Bristol Bay campus in Dillingham.
Excellent. Hi, Wanda. Welcome. Okay.
So this question is all about AHA and working collaboratively. So
I like this, the interdepartmental research. Complementing, it's another communications where that starts, right?
exactly. Building contacts. Mm-hmm. What are the obstacles?
This more of this.
Gloria?
Yeah.
No, this is Robert. You went to the Google meeting yesterday?
No.
No? Okay. There is a possibility to create a Google group, unlike a mail group where it keeps changing. You create a group in Google and you're like the administrator and you can add and delete people as they come in. That would be another avenue, of communications to where you can email the group versus it being like a list or a contact group. It's more formal.
Okay. I can look into that.
Just by looking at question 2, hi everyone, this is Andrea again. It does seem that everyone and I guess my colleagues kind of share the same issues with identifying obstacles within allied health. And specifically, they do talk about internships and externship site placement. I know that's a big challenge. So maybe even just, with question 2, the Allied Health Alliance members could identify some of those obstacles and maybe ways to kind of approach them. It looks like that's one of the greatest responses for question 2.
Got it. I'll scroll down. The last one was partners, of who we could be working with or improving stakeholder collaboration. I think a lot of this was based on I think that there were sometimes partners invited to AHA meetings to identify, possible areas of collaboration with industry.
That's great.
Okay, I'm going to pull up what I've kind of taken notes on so far while everyone was chatting. So here's the 1, 2, 3, 4, 5, 6 themes I kind of heard.
So for those that don't have it up on the screen, could you just quickly identify what those are, please, Gloria?
Absolutely. So increased communication and collaboration across universities and campuses across the state. Better identification, I guess I'd say, of faculty and administrative roles. Board of Regent mandate to expand health graduates. Advising communication identifying obstacles and approaches to overcoming them. And in the example that Andrea gave was internship and placement sites, improving interactions with stakeholders. I might not have got the faculty administrative piece right if somebody wants to take a better stab at it. I can't remember what that one was. Let me go look back here. Oh, reducing administrative burden. That's what it was. Let me fix that.
And that's one that we need to figure out exactly what that means depending on which which campus you might be working on. I think, Michelle, that's what you were wanting. We need clear definitions and identifying per unit. Is that right?
Well, I think it would be valuable for us because I think we all have a different approach to the way we handle our business out of necessity, not because we're not following guidelines. You know, some have more people to do some things, so sometimes faculty are doing some things because they want paid an overload, or they're the right person to do it, or I just think that discussion should be had.
Mm-hmm.
Especially with the way that this is worded, reducing administrative burden. So some obviously see that as a burden, and others who may have it, it's not the burden. So where is it? We need to identify expectations.
Oh, I'm sorry to interrupt. I have to leave, so I just want to let you know I'm off the line.
All right, thank you for attending.
Yeah, sorry about that.
Mm-hmm.
Hey everyone, this is Andrea again. You know, we had a really good speaker speak to us regarding the Lean Sigma 6 concept, which is all about reducing, unneeded documents, kind of streamlining your time while at work. So that might be someone we could contact on the UAA campus for insight on ways to reduce administrative burdens for faculty. That might be a good resource for that.
So I guess what are next steps after, did you want to pull together a smaller group to respond to these? Do we want to try to have an in-person meeting? I know that's something you suggested, Kathy.
So I think let's look at question 3 before we go to the next, because we have 6 items already and we haven't done question 3, right?
Well, I did look at question 3. Question 3 was the key partners.
Oh, the partners in the industry. Okay, that was the only one that came up from 3 then?
Well, that was the question.
Okay, yeah, it's all about that. Yeah. Okay, sorry.
Mostly it's industry. That's what's coming out of what people wrote.
Except for the yeah.
And then there's also that research thing.
The research piece.
Yeah, I'll note that as well.
So that it also it talks in here too about the department directors and upper management and the potential for research, and the program directors and division directors and deans need to be involved. And I think that it's interesting that I saw that somewhere else too about educating deans and directors, but the deans and directors are a key piece to AHA and always have been. And they're the ones that have been the majority in attendance at these meetings, at least in the past that I've gone to, compared to faculty.
Right.
So that's that historical piece, and we haven't seen that in the last 2 meetings that we had. So that was why I was thinking it would be nice to have a face-to-face meeting to somehow bring the deans and directors statewide back in and participating a little bit more.
Kathy Kraft, I don't know if you want to speak. This is Gloria. Kathy, if you wanted to note the August 17th All College of Health meeting at UAA, and I know that there was some discussion of bringing in some folks, so maybe perhaps that's a good time to do something like that.
Yeah, originally the All College of Health Day was Thursday the 16th, but there were no facilities or rooms available. So we're meeting on the 17th on Friday, and we are bringing we are able to bring some people in from outlying community campuses. So if you guys want to try and do something around then, that might be a natural timing. People may be busy though, because that's the first week, faculty and so on are back to school. So, but it's definitely something we can consider.
I think this is Kathy Winfrey, one of the things that when we took over and started in the fall without the previous historian, when Jan was gone and all of the other historians were gone from UAA, we had talked about what do we want to do and what is going to be our some of our goals and direction here. And even then we were starting to struggle the past year about meeting face-to-face versus meeting telephonically or however we chose to meet. And at that time, I thought I recalled we had all talked about meeting 1 time per year together, and then the 2nd time per year via telephone or GoToMeeting, however we wanted to do it, but that the face-to-face contact was really important. I think the College of Health meeting is really a different venue than what the Allied Health Alliance has, but if we could meet, I suppose if we would go at that time and have a separate meeting away from that area, because last year when we tried to have the Baja AHA meeting, it did not work very well. Do you think, Gloria?
Yeah, I would say break out.
I don't think it worked very well having it during the meeting either. We either need to do it afterwards or the day before or something like that.
Yeah, I think so. And I think that you're right, Kathy, that it's a really busy time of the semester to try and pull a lot of people away at that time for a meeting. I don't know if there's a better time, like September. Traditionally, we had met in October, I think, hadn't we, for those that used to participate in AHA? Wasn't it more in October that we would meet?
That sounds right to me. This is Leslie.
Thank you, Leslie.
It always seems like, yeah, it does seem like a better time.
And I know that sounds like a really time of far, it's a long ways away. And maybe between now and October, a smaller group could kind of look at some of these and then be ready to present back and talk about direction and where we want to go and how we want to look at all of these and increase that communication as a whole with recommendations.
I agree. I think that sounds like a good plan. I really like the idea of a face-to-face meeting. I feel like Jeff Jesse and Andre Rose would be very receptive to meeting with us. They seem very engaged with Allied Health at the UAA campus. So that might be also a good approach.
Well, in the past, a lot of the deans and the directors were there at the table from across the campuses. So I think it would be a good idea to try and get together, and we just would need to somehow figure out a day that works for the majority of people. And is October better than late September or early November? Does anyone online have a preference?
I think this is Gloria, as long as we get it out early enough that's the key. Just making sure that it gets in people's calendars way in advance, that will be okay, regardless of what we pick. But like you said, the beginning, the August dates are usually really crazy for people, so probably try to avoid that. But maybe either late September or early October, maybe that'll be better fitting.
So maybe what we can do, Andrea, you and I and Gloria can look at some dates, and then we can put out a doodle poll for people.
Sure, that sounds great. And I think any of those dates you mentioned would be fine for me.
Okay. And what do you think about, I mean, we can certainly go through some more of these today, or do we want to, now that we have maybe a smaller number to focus on, have whoever would like to volunteer get together and come up with some recommendations for our meeting, so that at the meeting we have something to start on right away? Leslie, do you have any thoughts on how we can move forward with the survey?
Yeah, I was just about to speak up. I was waiting for other people to talk, but I like that idea, and I'd be willing to help with you know, with a smaller group, kind of getting together and focusing on these things, and having, you know, something prepared for a face-to-face meeting. If we're really if we do some homework ahead of time, then we can really start tackling them and saying, how can we go about doing this?
Okay.
But I need more volunteers. Meaning they all
Yeah.
volunteer.
Yeah, I'll work on it as well. Andrea, was that you?
Sorry, what was the question?
Working in small groups. We're volunteering you to work on the small group.
Oh, that sounds great. I can, yeah, put me on the list.
I have Kathy, Andrea, Gloria, and Leslie.
Okay. So,
And
I
can
wonder.
email Kathy to us, the four of us, and just try to get that organized separately. But I think the other piece we have to consider for the doodle poll for the AHA piece, would be, you know, funding and talking to folks in advance about how we would cover travel costs. So, I mean, I don't know, maybe Kathy Kraft and I can kind of take it to the dean and see what he thinks. Maybe instead of the all college meeting, bringing folks in for that, we decide to do an AHA specific meeting in October and try to work it that way. I don't know. I think he was pretty set on trying to bring people in for that meeting though, but maybe we can talk to him about what came out of this group, and that might be a better venue for cross-campus, cross-university discussion versus the UAA all college meeting. So I'd be happy to do that, but I think also on the individual campus levels, what do folks have to contribute towards travel for this type of a meeting? And maybe we can kind of all pull those funds together to try to make it happen.
Right. I think that in the past, it was the individual campuses. If I'm not mistaken, that's how it was in the past when we went to AHA meetings, that it was not one, it was all participated in funding that.
So
when we traveled,
perhaps
it was individual campuses. But I think we would need to check with our each individual campus and see how that is. And we can all do that individually, and then maybe let either Gloria or myself or Andrea know if there's a problem with individual campuses. Then maybe we can see if that would come from UAA, College of Health.
And Kathy, I think I heard that Pete Penny's on the phone. I think he helped schedule a number of those, and they alternated at different campuses, as I think what you're saying. But Pete Penny might have the specific too.
That's accurate in that each campus provided their own travel to the meetings. We did try to alternate it between Anchorage and Fairbanks and other places if it was feasible. One of the ideas, the direction you're going is good. One of the things I would recommend is working towards some, as an actual outcome, something that's a product of that meeting. And what I'm thinking is how the Fisheries, Seafood, Maritime Initiative started off with modeling itself after AHA and brought in industry and all the, it started with the university and all the players and stakeholders in the university, but expanded it out to industry. And they came up with the working plan for the Fisheries, Seafood, Maritime. And it took off. It really it energized that group, and has led to the review of the TVEP proposals to talk about priorities as that industry sees it happening and shaping up, and increases the collaboration between industry and university. So if you had something along those lines, even if it didn't get to that point from this meeting, if everybody had that vision, I think that would help direct the conversation on becoming really productive in terms of takeaways and actionable items, and the communication about budget necessities, and then the outcome of more people employed in allied health, which is the ultimate goal for all of this, right?
Mm-hmm.
And
this
is Kathy. I'm
by the
going to
legislature.
suggest the same thing. Go ahead, Pete.
I was just saying that work plan was endorsed by the legislature and highly promoted, and has led to the conversations about centers for excellence for maritime and such out of federal funding and all kinds of good things.
And Gloria, and Kathy and Andrea, this is Kathy Kraft. Before you bring it to us at the dean's office, I would suggest that kind of what Pete was saying, that there'll be goals with some outputs as well as a budget, so we know how much money we're talking about as far as the travel goes. That'd be great.
Okay, that sounds good. So we will meet over the next couple of months and figure this out, and then date and get information back to everyone, and especially back to the dean, and see where we're at with that piece.
Sounds good.
Yeah, that was really good input. Thank you for your input. Do we want to, I think we're still on survey results because we, on the agenda, do we want to focus on back to the agenda a little bit?
Sure. The next item, okay. Are we through this one was future direction of AHA and revised survey results. I think we've got that covered.
Yep.
Up next was an AHEC Scholars Program update that I wanted to just put together for the group to kind of give you a preview of what's coming to your campuses this fall. So I'll slide through this fairly quickly. And I did attach it so that you have this presentation as well, if you needed to reference it. But we've been working really hard at the program office here at UAA with the AHEC program. There was a lot of changes in our last federal funding proposal through HRSA. They've been doing this with a lot of different programs. The AHEC is one of those that was really revamped in this last cycle. And rather than focusing so much as we have in the past on pipeline programming, we were really being pushed nationally to focus more on students within health programs of study. So we are not going to give up doing pipeline programming. We still have funding streams coming in from Carl Perkins, the Mental Health Trust Authority, and the Department of Labor to continue some of that youth pipeline program work. But we do have to refocus our energy, and in doing so, we've been tasked, as well as all the other AHECs in the nation, to create an AHEC Scholars Program. And what this is really, it's HRSA's way of having us focus on improving diversity and distribution. We will have a priority on this program for underrepresented students, which is why we will have rural cohorts in all of the regions throughout the state. And then we also will have this targeted experiences for the students that are here at UAA and in Fairbanks at UAF to get them more experiences out in rural communities, in rural locations, working with those underserved populations. So those will in turn improve both diversity and distribution of the healthcare workforce. The program is kind of scripted and strict in what HRSA is having us do, but we've tried to work within those parameters and find as many loopholes as possible to make it work for Alaska. It is a 2-year training program, and the requirements are sort of, some of them are inside program academic requirements, some of them are outside. So to give you a little bit more information on that, it does require 40 hours per year of didactic training. And that didactic training, we have clarified with the loopholes as we're finding them as we go along, that those didactics could include elective coursework. So it could be electives that students take that count towards their degree program, or if there aren't any electives that they take, because we're finding some of the graduate programs and certificates really are limited in what electives are available. We are putting together what we're considering an a la carte menu of online modules and training opportunities, including existing content, workshops, curriculum, webinars, and things that we found and collaborated with other AHECs across the nation to put together. So the students will in turn have kind of a menu of options of reaching those 40 hours of didactic requirements for the program. It will also include a requirement of 40 hours of community-based field experience in a rural or underserved setting. But the key on that is that those 40 hours of community-based experience could be part of the student's program of study, which is great because that means that the hours they're doing, for instance, at Pioneer Home or at a rural hospital because they're located in Bethlehem as part of a nursing cohort, anything that they're doing that's in a rural community that's part of their program of study could be counted for those 40 hours of field experience. And the field experience doesn't have to be purely practicum or clinical. It could be things that we run already, like the Rural Immersion Institute of the North. It could be existing clinical requirements, or it could be community-based projects that are part of a course where the student has to go out into the community and do work with the community. We can help as an AHEC securing them with experiences in rural and underserved populations so that they can then accomplish both the AHEC Scholars requirements in addition to whatever their coursework is requiring. We also wanted to have the students have an opportunity to share what it is that they do with the AHEC Scholars program to kind of promote it into the future. So we do have the goal of having public presentations for the students to take part in annually, and we're hoping to link those to existing conferences like the Public Health Summit and different things, and then have students go attend those events. So the key to the didactics and what we're really doing now, we're creating kind of a catalog of all the course offerings throughout the state from all the different campuses, UAF, UAS, APU, and Illisagvik, wherever there's courses that contain some of these 6 core topic areas, that contain content in these 6 core topic areas. I had my staff scan through all of the course catalogs and identify what they think might be applicable here. And then the next step is we're going and reaching out to faculty members. And we're talking to the faculty members about what courses we identified, whether we missed any courses, whether the ones we identified actually have content in these core topic areas. And we're hoping by the end of April to finalize that catalog so that students have a list of all the electives that are possible for them to take that would count towards the didactics. In doing that, we're also identifying those webinars and conferences and different events that are already in existence throughout the state that we can latch onto and make available to students. So your regional AHEC centers will be reaching out to your campuses within the next, actually it might have already begun, and it's going to continue in through April to meet with your faculty and talk through some of these things so that we can really get this a la carte menu of options for didactics for students to be as flexible as possible to meet the scholars' needs while also meeting their individual needs. Why would students want to participate? I would say this is probably the question I get most of all from everyone involved in the whole entire thing. We're all asking ourselves this question. When I first got the funding announcement, I thought, you know, if we build it, they might not come. What's going to make them come? Like Field of Dreams, I know, but I was really concerned with what's going to incentivize this experience. So we did talk to students, we talked to faculty, we talked to health facilities, and we've talked to other AHECs throughout the nation. And this is kind of what we've come up with and what we've been able to secure here in Alaska. Of course, the valuable experience. Not a lot of students have the opportunity to go out to a rural community and do this type of work. So a lot of students are interested, but they can't afford it. The resume building, that would help them stand apart from other students. They're gaining those professional contacts with the networking opportunities that they have in those communities when they go out and do those experiential elements. We are going to be covering housing and transportation for the students that we send out to the rural communities. Every AHEC scholar will receive a stipend. We just got word yesterday from Bonnie Nygaard that our TVET proposal was approved. So we do have funding to be able to put this on, which is wonderful. And we're looking at ways to expand that funding opportunity in the future and have even more money available. So we're still working on it, but we do have money to actually start this off in the fall. HRSA is actually going to be giving national recognition and signing off on all of the AHEC certificates. We're going to have a standard certificate that AHEC scholars throughout the nation receive, so they'll get that national recognition. And then we're also working with National AHEC Organization to build connections with national and state loan repayment programs, like the National Health Service Corps, the Nurse Corps, the SHARP loan repayment program here in Alaska, and then of course the Indian Health Services loan repayment program nationally. So the more we can do to build connections there, we're hoping that that's all in the works. It's more of a long term, but that's where we're aiming, that students that are AHEC scholars, that they show this rural and underserved interest, that they would actually get prioritized somehow in these loan repayment programs once they do go out and work in a rural community. But in doing all of this, one of the things we noticed, and we were really, we were committed as a state to the fact that we didn't like a lot of the parameters for the AHEC Scholars Program from HRSA in that they did not allow for pre-majors and high school students to participate. We really felt that to build that strong representation of the pipeline, we needed to have some way to identify students that were future Rising Scholars, which we tokened the Rising Scholars Program. And the idea of this is to do whatever we could individually, have an individualized opportunity for students that are identified by faculty members, identified by the AHEC center directors and staff as prospective students to enter these programs or be pre-majors in these programs. We're seeing that a lot of those diverse students aren't getting in. They're not getting admitted into the programs. So what can we do to help bolster their grades, help bolster their abilities, their study skills, and get them where they need to be? So we decided as a state that we really wanted to continue to work with those students and not turn them away, especially if they're voicing an interest in staying in their rural communities or working specifically with underrepresented or underserved populations. So the idea of the Rising Scholars Program is that we will have a pot of funds available for our AHEC centers to work individually with students and provide things like access to our camps and academies, tutoring services, tuition waivers, rural job shadow experiences, targeted developmental studies workshops in the communities, working with the faculty from the different campuses, test prep support for entrance exams to get into programs like the nursing program, All of those individualized opportunities would be, beyond this list, really whatever a student's needs were, whatever we can do to help those students that we are identifying as rising scholars get to where they need to be. So this is something that we're going to launch in conjunction with the AHEC Scholars Program this fall. We do have a live application. The link that you have, this web URL is live, so students can start applying now. If the students are accepted, we do have just like a standard collection of different things like vaccination records, background checks, all of these things we're doing just to prepare them for whatever site we might place them at. We're really going to be working closely with faculty, and we want as much overlap as possible. So working with the faculty to make sure that if we have a student interested, that we're getting whatever they need, their requirements are for their program counted towards this program. So what can we do to help? Do you already have a placement site, but you just need housing? Do you not have a placement site at all, and we have to help you there? So really working collaboratively with the faculty and knowing that these are the things students need to get placed in a lot of these communities. We made this part of the requirements upon acceptance. That way we can have it all in place and not have to worry about scrambling to get things together. We are going to be running a pilot this summer alongside of our Rural Immersion Institute. We have 16 students that are going to be part of that from this campus here in Anchorage, and we're going to be sending them out to rural sites this summer in late July, early August. And we're excited to see how that goes and start those relationships, and then, formally launch the program in the fall. It will be rolling applications. So our target here is 90 AHEC scholars a year, which is the target that's set by HRSA. We did not have a say in that. So we figured rolling applications is the way to go. We can, work with students individually and try to get as many as we can into the program early on. And then once we start to have a following and we have more students interested, that's when we'll start worrying about application deadlines. But for now, we want to try to capture as many students as possible. And the eligibility, any health programs included. So no matter what campus you go to, if you're enrolled in a health program, you are eligible. We also got acceptance. So all the associate's degree programs, bachelor's degree programs, and graduate degree programs that we offer with partner institutions throughout the state, those are all eligible students to apply. And in addition, we put in a prior approval for special approval to include certificates. So CNAs are actually included as well, EMT, paramedic, and I'm missing something here. Oh, and our tribal health, our DHATs, behavioral health aides, and CHAPS are all eligible to apply. We hope to expand that way, but we just wanted to make sure we cast the net as far and wide as we could to meet those really, really significantly high numbers of students per cohort. So that's what we have in the works. Dave Berry is my lead in our office that's been coordinating a lot of the logistics, and his contact information is in the presentation I sent out as well. And just be on the lookout, because we're going to be having our center staff are going to be working closely to connect with faculty members. So I wanted to give you all a heads up that this is in the works and it's happening. And it's going to be a really great opportunity for all of your students and a great opportunity for collaboration.
Wow, that's awesome.
Yeah, I know that's a lot. And all the slides I did send out, so in case you aren't following along, you can access them. And if anybody has any questions, I'd be happy to answer them, or you can connect with me offline. If you'd like to have an opportunity for us to talk to your faculty and staff that are coordinating health-related programs, please reach out to me. The more support we have in setting up those meetings, the better. I've already met with some of the departments here at UAA, and their faculty members are super stoked for this. I think it's a great opportunity for everyone. Social work students are really stoked, and faculty members. I've talked to both a group of students and faculty, and they're really excited. I've talked to the health sciences, the PA program, the Bachelor of Science in Health Science, and the MPH program about it. And I know Robert. I've inquired about talking to allied health faculty, so that's kind of on my list, as well as nursing. But the more support that you all have at the director level, getting us connected, or with the connections you already have in your university and your campuses, the easier it's going to be for us to set up those meetings and kind of talk through what this will look like. in your community. And it will look a little different in each of the campuses, but we're really excited to move forward.
Great, thanks, Gloria. That was really helpful.
You're welcome.
Gloria, this is Kathy. I know that's been a lot of work for you. I've heard from our AHAC here bits and pieces of it when I've attended their meetings. And I know it's very detailed, and you guys have been working hard for a long time on this, so that it sounds great. Thank you.
You're welcome. I really have been listening to everyone, and that's why we wanted to make this a la carte menu. You know, as many options as possible, the more the better, the more flexibility for the students, the better. And, you know, we're trying to listen and respond and try to work through as many of those loopholes as we can to make it happen in an Alaska fashion.
Yeah, that's great. Any questions for Gloria? Okay. Member updates. Should we run through and see what's going on at different campuses?
Sounds good to me. I can, I'm going to give an update for Ellen if you give me a chance to pull that from her. But in the meantime, if anybody wants to just get started.
Sure, this is Andrea. I can start it off. Is that okay with everyone?
That's great.
Hi, everyone. My name is Andrea. If you're not familiar with me, I'm the program director and faculty member for the UAA Medical Assisting Program. And I've been lucky enough to participate in a bunch of really allied health specific meetings. And I think some of our survey questions have touched on a lot of the common issues or obstacles that are kind of going on across the campuses. One thing that we've really been looking at and thinking about is the doubling of health graduates by 2025. And, you know, I definitely think that's probably a good thing in the whole scheme of things in the big picture. But looking at it more closely, a lot of my colleagues have identified, once again, a few obstacles for obtaining that goal. And I'm sure some of the other allied health programs across the campuses are identifying those obstacles as well. For me, I'm in the situation where we have one group of students who complete their didactic training, and then they head to externship in May. And I usually have about 20 to 24 students to place all at the same time. So I'm pretty much maxed out in that regard for externship site placements. And the thought of doubling my capacity to 50 or so is really a challenge. And I'm not even sure that would really be good in terms of oversaturating the market. So that's kind of one thing I think that me and a lot of my fellow allied health faculty members are thinking about, the kind of reality of that. So that's one kind of big issue. I think that's probably on everyone's list. And then otherwise, specifically for medical assisting, I've done a lot of accreditation work. I had to remap a lot of our curriculum so that we can identify where the competencies are in each course. And I'm a little bit of a control freak, so I've moved a lot of the competencies out of several of our kind of accessory classes into the core classes of medical assisting. So that'll be a lot easier for not only for tracking of competencies, but also I think for the transfer of students from other campuses into UAA. I know that's one of the obstacles we identified in previous AHA meetings, is that a lot of allied health students, let's say they start off in Fairbanks and then they transfer to Anchorage. It's really hard for these accredited programs to identify what competencies have been taught and assessed and where the student's at. So I think that's going to streamline that process. So it was kind of a double-edged sword. It was a lot of work, but once again, it kind of helps me kind of streamline all that data, especially when we're collecting it for assessment purposes and for our external accreditors. So that's one thing I've been working on. Let's see what else. Just kind of thinking about the next academic school year. We're probably going to be advertising pretty soon for another full-time faculty member in my department here soon. So that's always exciting. That means in my workload in the fall and spring of next year, I'll also be training another faculty member, which, as you know, is probably a pretty big job. But otherwise, everything's looking good. I'm just thinking about my students headed to externship in May. I've already secured quite a few sites, including a few new sites, which is always exciting for creating community partnerships and things like that. So I'm in a good place right now. I always think spring break is my catch-up time, but I feel like spring break is almost over and I have a lot more catching up to do. I'm not sure if that's how everyone else feels, but otherwise everything's going great. I'm feeling good about the next year, and yeah, just excited to kind of move along.
Thanks, Andrea.
Thanks, Andrea. I agree with you on that. Spring break as a catch-up time.
Ideally, right?
Yep. Gloria, did you want to do your update for Ellen?
Yes, I have it right here. So Ellen shared that she is working on establishing an AAS in speech language pathology, which would lead to licensure as an SLPA, a speech language pathology assistant. So that's in the works here at UAA. She also mentioned that undergraduate students are taking the SLP minor from both health majors and education majors. So she finds that really reassuring that minor is working really well. And to date, 50 students have completed the SLP Master of Science program with East Carolina University. And of those 50 students, 90% have accepted initial positions in Alaska schools, hospitals, and agencies. So overall, just a great update, lots of good things she's got going on. And she'll keep us up to date and informed of the development of that new program.
Wow, that's exciting.
Yeah, that's what I thought too.
Yeah, absolutely.
Gloria,
I'm just going to go down. Go ahead.
I'm sorry, which campus was going to be the new SLP program?
So there is an SLP program here at UAA. Right now she has a master's program that she has a partnership with East Carolina University. And there's also a minor in SLP that she says a lot of undergrads have been taking in both health majors and education majors. But because of all the interest, they're really looking at establishing an AAS in speech language pathology here at UAA.
Wow, how exciting. Yeah, thank you for that update.
No problem.
This is Kathy. I was just going to go right down the list and see for the program updates. Wanda, are you still with us?
Yes, I am. I don't have anything new to add, I don't think. Thanks, Kathy.
Okay. Leslie, how about in your areas? Leslie, are you still with us?
Looks like she had to get off the call.
Okay, so how about Robert?
Thank you. Some things we're looking here in UAA for Allied Health is I'm looking for an adjunct for our Surge Tech program. The individual has to be what they call CST certified. So that's something critical I'd like to get taken care of. So if you know somebody. Second, our dental hygiene program was recently approved by their accreditation organization to move from the associates to the bachelor's program. So starting in the fall, the cohort will start in the bachelor's program. Our dietetics and nutrition program got approved for a master's program, and they're right in the middle of interviewing individuals to select to fill a faculty spot for that. In our medical lab sciences program, we have 2 people retiring in May, so we've been trying to fill those slots. So it's both of these individuals together have over 40 years of experience, so it's going to be hard to fill those shoes. We're also, as Andrea indicated, looking for a medical assistant with some coding background. And that's pretty much it for Allied Health currently.
That sounds like enough for right now. Thank you. Mary, are you still on the line?
Yes, I am. Mostly I wanted to attend this meeting to just get an update. I have nothing to add.
Okay,
Other
thank
than
you.
YKHC is building a $300 million addition to the hospital, and they're estimating, depending on who you talk to and what day, between 300 to 500 new positions. Sorry about that. 500 new positions associated with YKHC once that addition is finished. Thank you.
Yeah, that sounds like overwhelming.
It is overwhelming. They've started with dental assisting, so we started talking to CTC and Jennifer Filodi last year, and are hoping to have something in place maybe next year.
Yeah, exactly. So, yeah, if there's other identified, we can maybe talk about those as well, so we can start increasing those numbers. That'd be great.
Yeah, thanks.
Okay. Pete, are you still online?
Yeah, and I'm filling in for Kristen while she's coming back to work soon. She was here yesterday for a couple hours, come back from maternity leave. So what we're doing this afternoon is we're going to go over and visit the folks at Manilik, which is Katsu's, or this region's health corporation, and look at the needs for healthcare training and coursework. We have kind of this quasi apprenticeship program where the dental department director here is teaching 2 initial courses, and then those that keep an interest in going towards dental assisting, then they take on training those folks to completion. And we're looking at, with the help of BLAST, creating a biomedical certificate, and how that could help across the region. What else? Well, there's a lot of other stuff, but that's primarily what's happening with allied health activities.
Wow.
Okay. I'm sorry, can you clarify who you were filling in for? I was trying to catch up with typing and I missed it.
Oh, Kristen Dow is the interim campus director officially. DAU. Just DAU, that's it. DAU.
Oh, Dow. Sorry. I'm trying.
Thanks, Pete. Kathy Kraft, do you have anything to add?
Well, overall, from the College of Health Dean's office, I think most everyone knows we had a lot of focus on the nursing program last fall. We went out to all of our community campuses and the larger UAS and UAF as well. And the College of Health overall is going through a reorganization, and we're looking at efficiencies and which schools and departments might best fit together. So we've got a few ideas on that, and groups that are working together to figure that out. We also have been working on CNA programming in Matsu and Juneau in the Southeast regions. And I think just like with the Bethel area looking to bring on 300 to 500 new workers, we've got a skilled nursing facility and 2 long-term care facilities going in out in the valley. Matsu Regional Medical Center is also building a 36-bed behavioral health unit in addition to what Alaska Regional is doing. So we're beginning to focus a little bit more on our behavioral health programming, and had a meeting last week with Juneau with Southeast on, what they might offer in the Southeast region. We're also putting together a meeting with the Fairbanks group. Richenda and I are working on that for April 23rd to come up to Fairbanks to talk about some additional behavioral health programming. So we're really taking seriously the whole doubling the health graduates by 2025. So we're just, trying to do what we can to support the various campuses across the state in meeting that goal. And the Behavioral Health Alliance will meet in April, and we will have new co-chairs, David Motzley from the School of Social Work and Robin Henry from Human Services will be co-chairing the Behavioral Health Alliance. Diane McCachran and Joanne Bartley served for 2 years, and we will be switching chairs next month.
Did you say Robert Henry? Is that right?
Robin, R-O-B-Y-N, Robin Henry.
Okay, sounds good. Is there anyone else online that I've missed? Okay, so a quick update from CTC. We are working on a medical scribe, getting first an OE and then a certificate program going for that. So I have a meeting here shortly to kind of finalize those submissions. And I think that we could too increase our numbers in some areas, and those are the things that we're working on. We have a faculty position posted as well, as we lost a faculty last fall, so a position. So we're trying to replace that person, and that would help us to be able to increase those numbers. We are working with Bristol Bay for dental assisting and with Bethel, so I know those are in the works, and also with Northwest Campus for their CNA program coming up in May. So it's busy, it's moving, it's exciting, there's lots happening, and it sounds like we all need to kind of continue focusing on those numbers, and maybe we could map some of that out once we all have our ideas and goals a little bit more defined for numbers. Okay.
Kathy, Kraft, I forgot to mention one thing we're pretty excited about. We've hired a outreach simulation coordinator, someone that will be housed in Mat-Su because we didn't want the individual to kind of be sucked into the Anchorage Bowl. So, but this person will be working with the community campuses on simulation scenarios, keeping the mannequins and equipment and software working. She's going to start next week, and we'll probably spend a couple of weeks between Mat-Su and Anchorage just kind of learning the systems, but we'll be inventorying what we have out in the communities, and then we already have a couple communities that have asked for her assistance fairly quickly, so we'll be offering that up and seeing how we can partner in the smaller communities with our nursing programs and whatever EMT or paramedic programming, so everyone can get the biggest bang out of the buck with the outreach coordinator, but also with the simulation equipment we have across the state. Thanks.
Oh yeah, that's exciting too. That's great. Okay, I think that's it. The next meeting is the last agenda item, and we'll kind of doodle poll that for hopefully a face-to-face once we get some thoughts and figure out the financial piece for that meeting. Does anyone have anything else that we need to talk about? Okay, hearing no comments, then Gloria, Andrea, and Leslie and I will get together and come up with meeting dates for ourselves for the smaller task group, and then also dates for next fall.
That sounds good, Kathy. I will also render this recording and then share it with the entire group, so in case anyone who missed it can view.
That's great. Thank you so much.
No problem. And then Kathy, if you could just send me when you have a chance Jennifer's actual email address, that'd be great.
Yes, I will. I'll do that next. So that's wonderful.
Awesome.
Thank you all for coming during spring break. I appreciate it.